Breaking news tonight as health officials confirmed late this afternoon 8 new cases of COVID-19 in our province. One of them linked to this private university in downtown Vancouver. That university closing its doors today. One of several major developments as the number of infected British Columbians spikes significantly in just 24 hours.
Good evening. We begin with a big increase in the number of COVID-19 cases in BC, and that's not the only troubling new development as experts work to contain the outbreak. The most significant news today, the fact BC now has its first case of what experts call community transmission, a patient contracting the virus who hadn't traveled outside the region or been in close contact with a known case. CTV's Shannon Patterson reports on how the COVID-19 situation in BC is getting more serious and more complicated.
Today's announcement from the provincial health officer, a stunner.
We do have 8 actually new cases within the last day who tested positive for this.
They include BC's first COVID-19 case linked to cross-border travel from Washington state.
One of them is a resident of Seattle who is up here visiting family in the Fraser Health region and was tested positive on her visit here. So clearly that is of concern with us, and we are working with our neighbors to the south in Washington state to try and determine where her exposure might have been.
But even more concerning, BC's first case of community spread. A woman with no relevant travel history or contacts with any of our known cases, only detected because she was tested for regular influenza.
So we picked up this person by that testing protocol. So now we need to find out, okay, she hasn't traveled. There's nobody in her family, immediate family, that's traveled. So where did she pick this up? And that's what the public health investigation is. That's what we do. We find out exactly where she's been, who she's been in contact with, have any of them been sick.
4 of today's cases are close contacts of a man in his 60s who recently traveled to Iran who tested positive last week. They include a student at this small downtown Vancouver university, which is now closed through the weekend for a deep cleaning.
We've contacted the students who were in the classes that may have been exposed by the students. And we've contacted all the faculty as well, and we've made arrangements for the students to stay home, those particular students to stay home for 2 weeks.
The final 2 cases announced today, a man in his 60s and a woman in her 50s from the same household who just returned from Iran. 13 of our 21 cases are linked to Iranian travel. Health authorities have been able to track down their close contacts. But the community spread case presents a much bigger challenge. She got it from someone, but who?
So there's likely at least one other person out there who's either had this disease or has this disease, and we need to find them and find their contacts so we can stop any further transmission.
So Shannon, it is crucial that health authorities track down the person behind the community transmission who gave that woman COVID-19. So how will they go about doing that?
Well, they'll look first at the woman's close contacts, friends, family, coworkers. Are any of them sick? But if her transmission was through casual contact with a stranger or, say, hard surface touching like an infected door handle, it could be impossible to trace the source of her COVID-19. Yi Jung?
Thank you, Shannon.